My name is Dr. Dmitry Tsvetov, and today we're going to discuss post-operative instructions after a wisdom tooth operation. The first thing we're going to go over are the medications that are going to be prescribed for you or your loved one. And next, after that, we're going to discuss precise instructions of how to take care of the mouth after the extractions. So let's go over the prescriptions in a little bit of detail. The first prescription that I'm going to prescribe is going to be for amoxicillin 500 milligram tablets. This is an antibiotic. If you or your loved one is allergic to penicillin, an alternative medication would be clindamycin 300 milligram tablets. It's very important to make sure that you take a full course of antibiotics that is prescribed, and typically this is for about a week, 3 or 4 times per day, depending on whether amoxicillin or clindamycin is written for. The next medication is Motrin or ibuprofen, 800 milligram tablets. This is a medicine for both pain and swelling. It's incredibly important to make sure that for the first 2 or 3 days after the surgery, this medication is taken around the clock every 8 hours. This will ensure that there is always a constant level of the pain control medication in the system, which is going to make it a lot easier to manage the post-operative pain. If after 3 or 4 days you notice that your pain level is manageable, you can start to taper off on the Motrin, but do continue with the amoxicillin or clindamycin until it's all gone. The next medication we are going to speak about is going to be Tylenol 3 with codeine. This is a second medication for pain. It's a little bit stronger than ibuprofen. This particular medication also has codeine in it, which is a narcotic, and therefore it is addictive, and it also has a tendency to make you nauseated. So I would strongly encourage you not to use this medication unless absolutely needed. The Motrin or ibuprofen taken every 8 hours around the clock should be sufficient for management of the post-operative pain. However, if it's not enough, then you can go ahead and take 1 to 2 tablets of Tylenol every 4 to 6 hours. So, for example, if you took the Motrin and an hour later you're still feeling pain, you can go ahead and take the Tylenol 3 with codeine. The next medication we're going to speak about is Peridex rinse. This is a mouth rinse that you're going to start the day after the surgery. It's incredibly important to remember that on the day of the surgery there is no rinsing, no tooth brushing, and therefore the rinse should not be used. But the day after the surgery is when you should start using the Peridex rinse. And this medication is also 3 times a day, and so it can be taken together with amoxicillin, the Motrin, and Peridex all together. And you can keep using that medication until the bottle runs out, which is probably in about 7 to 10 days. The last medication we're going to cover is going to be a medicine for nausea, which is Zofran 4 milligram tablets. I prescribe this medication as needed because occasionally after the surgery the patient can feel a little bit nauseated. This can be due to a variety of different factors. For example, if the patient swallowed some blood, it can make him sick to the stomach a little bit, or if they took pills on an empty stomach, or it can also be the post-operative effect of the anesthesia. Now, I do want to let you know that before the patient leaves the surgery, we do inject the Zofran intravenously if the patient is being put to sleep for the procedure, and so they should be okay for the ride home. However, if at home they also feel a little bit nauseated, this is a medicine to give them. Again, this is just as needed. So among all the prescriptions, the ones that are the most important ones would be the antibiotic, either amoxicillin or clindamycin, the Motrin 800, which again is to be taken every 8 hours around the clock, and Tylenol 3 with, and the Peridex, which is a medicine for, which is a mouth rinse. And then the as-needed medication would include the Tylenol 3 with the codeine and the Zofran. Now we're going to move on to the actual instructions as far as what to expect and how to manage things after the procedure. The first thing to keep in mind is that immediately after the surgery, the lower lip, chin, and the tongue will be pretty numb. And because we inject longer-acting local anesthetic, mainly Marcaine, you can expect the numbness to continue for up to 8 hours. So, for example, if it's late evening hours and you had your surgery in the morning and you're still having the numbness on the lower lip, chin, and or tongue, that is to be expected. If you are numb the following morning, you should give our office a call so we can evaluate this in a little bit more detail. The next thing we're going to talk about is bleeding. So when you or your loved one leaves the office, they'll be biting on gauze. They'll have one gauze on the right side of the mouth and one gauze on the left if they had all 4 wisdom teeth removed. So when you come home, what you'll need to do is you'll need to take that gauze out, take one of the new ones that we give you. You're going to fold it twice until it's about 1 inch square. You're going to put one on the right side, one on the left side, and you're going to ask them to bite down again. Pressure is what stops the bleeding, so it'll be very important for you to change the gauze every half hour for about 3 or 4 hours. At the end of the 3 or 4 hour period, what you should be noticing is that each and every time when you change the gauze, there's less and less bleeding on it. And that's really the key. As long as you're noticing that each and every time you change the gauze, the gauzes are getting less saturated with blood, that's all you can hope for. Keep in mind, you will never get the bleeding to stop completely. There is always going to be a little bit of blood on the gauze, but as long as it's not saturating the gauze within like 2 minutes of being placed in the mouth, it is completely okay. If you notice that the bleeding is not slowing down and that the gauze is just as red as it was in the beginning, you should definitely give us a call, bring the patient back so we can reevaluate this more closely. Now let's discuss the swelling after the surgery. Keep in mind there will be swelling, especially if the teeth were impacted. The way the swelling works is it usually goes up for 2 or 3 days and then it slowly starts to improve. So if, for example, your surgery was on a Friday, it's completely normal and to be expected that the maximum of the peak swelling is going to be on Sunday, maybe even on Monday. After that, it should begin to get better. There are a couple of things that you can do to help you minimize the swelling or perhaps even avoid it altogether. The most important thing is to make sure that you're icing the face for the rest of the day after the surgery. To do that, you can either use an ice pack or you can also use a bag of the frozen vegetables and apply it to the side of the face for 20 minutes and then to another side for 20 minutes. And then keep switching it back and forth just like that, pretty much for the rest of the day. The day after the surgery, icing is really not going to make a difference because it's only the most effective on the day of the surgery. You should also consider sleeping elevated on a couple of pillows because keeping your head elevated will prevent the fluids from accumulating in the surgical area and will therefore also minimize the swelling. One more thing I want to cover, which is incredibly important, is to make sure that after a wisdom tooth procedure, you practice opening your mouth fully. In general, people tend to avoid opening their mouth all the way after the surgery because it hurts when the incisions inside the mouth are stretched. So as a result of not opening the mouth for about 3 or 4 days, the muscles right here become very tight and they clamp down. And as a result, now you're trying to fight these muscles to open your mouth, which is incredibly hard to do, and you end up with the lockjaw. The longer that goes on, the more challenging it is to open your mouth because the muscles become really stiff. So, to avoid that problem from happening, it is incredibly important to make sure that the day after the surgery, you or your loved one are able to open your mouth back to normal. The normal opening is being able to put at least 3 fingers vertically between the front teeth. The final thing we're going to cover is the foods that you should eat after the surgery. For the first few days after the procedure, you probably will want to stick to softer, mushier foods. Things like mashed potatoes, yogurts, cottage cheese, scrambled eggs, ice cream, and milkshakes are very well tolerated after the procedure. Definitely avoid anything hot in terms of the temperature, spicy or crunchy. Also, avoid drinking through the straw for the first 24 hours after the procedure. After the first few days, you can slowly try to transition yourself back to regular foods, but obviously you should avoid anything crunchy for as long as possible, because crunchy things like chips and popcorn tend to get lodged underneath the skin of the mouth, and it can be a little bit unpleasant. If you have any questions, you can always call the office for further instructions or for explanation of the things that you need some help with. And we here at Temecula Facial Oral Surgery are always available to help you. Thank you so much for your attention, and we're looking forward to seeing you for the post-operative visit. Thank you so much, and have a good day. Bye-bye.